What information should I know about my myeloma?
The easy answer is you should learn as much as you can. If you're newly diagnosed, there's so much new terminology, it can be overwhelming. The information will come over time. Um, you will learn the terminology over time. You'll learn the names of the drugs over time. But I'd encourage you to not be shy about asking questions of your doctors, your nurse, the experienced patients, and the advocacy groups to help you learn more about your myeloma. At least learn your specific myeloma markers. How does a doctor tell whether or not a treatment is working? How does a doctor determine what treatment might work best for you because perhaps you have markers that are considered high-risk mutations or you don't have those mutations? Learn your myeloma markers and learn the names and dosages of the drugs that you're taking. And just to make it more complex, unfortunately, there are 2 drug names for every drug you're taking. So good luck with that. It will come in time. Don't be overwhelmed. And just don't be afraid to ask questions. For myeloma patients, at some point, for most myeloma patients, a treatment will stop working. And you want to have an idea of what your next treatment, what your next lily pad will be going forward. And I think those are the things that I think are most important in terms of learning about myeloma. Your markers, the drug names, the dosages, and maybe next treatment.
It's important that you know your myeloma because your myeloma is not the same as my myeloma or somebody else's. Myeloma is a very heterogeneous disease. We should say cancers. It's plural, not singular. And the way your myeloma presents can be so different than somebody else who might have the very same lab numbers that you have. You need to know what your bone marrow plasma cell percentage is. You need to know your SPEP. You need to know your M spike. And really, you should know your kidney status, such as your creatinine. And if all of these numbers seem strange or the terms sound funny to you, it's important that you learn these terms. Myeloma is going to be with you the rest of your life. And the more you know about it, the more you learn, the more you're going to be able to make good treatment decisions. It's your cancer. It's your job to know your enemy.
There's several tools available that you can use to track your information. But I think the important thing about HealthTree is not only does it allow you to track your information, it provides you with recommendations from some of the best myeloma specialists in the world on what works best for you. That happens to be something that has never existed, is sorely lacking, and is something that this and the University Myeloma Crowd University help to fill. So you need to know all your information as best as you can, and you need to know what your current plan of treatment is, that you don't necessarily have to have a myeloma specialist that you go to every month, but at least he's working with your local oncologist to provide you with good and excellent care.
Typically, the more myeloma you have, the more protein you make. And it's critical for you to know your protein. You need to know your protein. It's a big deal in your monitoring. These proteins are actually antibody proteins or immunoglobulin proteins. They're proteins. And these proteins are made out of 2 components. A light chain, and if you don't know light chain, you're at a major disadvantage. You need to know light chain, and a heavy chain. And your physicians use that as indirect measures of the activity of your disease. And they actually use it to determine the depth of your response, your benefit. Now that's an indirect measure. The only direct measure is the bone marrow. So you can have two choices. You can get your protein, your heavy chain and your light chain measured every month, or you can have a bone marrow every month. Show of hands. Because really what we're interested in is how much myeloma is in the bone marrow, but we use the protein measurements as surrogates because the working assumption, since the weeds make the protein, that the protein levels over time are a good reflection of how many weeds there are. So if you're killing the weeds, the protein should be dropping. If the number of weeds are unchanged, the protein should be stable. And if the disease is progressing, then the protein should rise. So it's very typical that every month or whatever your monitoring interval is, you're having a measurement of your light chains. There are two types, kappa and lambda. You should know which one you have because that involved light chain is a big deal for your provider in terms of what is the activity of the disease. There's also a heavy chain. There are two types typically, G and A, or IgG and IgA. That commonly will also be measured. And it doesn't matter which you have, you need to know which you've got because it's key to your overall monitoring over time. And there's a third measure that, and they're all good measures, where you have a SPEP, and what your doctor will say, and leave you bewildered, will talk about your M spike. And the M spike is just another way of measuring the protein. It's different from the way in which we measure the heavy chain GA or the light chain kappa lambda, but it is a legitimate measure of the activity of the disease. It's the marker, it's what we use to determine how you're doing over time, and we use it as a response, and it's relatively simple because a lot of these things go back to the 60s. If the protein went down 25%, we say it's a minor response, 50%, it's a partial response, 90%, a very good partial response, 100%, a complete response, and then there's some nuances in there about what does 100% mean and ways to actually dive deeper to find out how really deep the response is. But you need to know your myeloma protein. When I do my second opinions, I see a lot of engineers. I don't know what it is about Rochester, Minnesota and engineers, but they come and they bring me an Excel spreadsheet that shows a graph of their protein and what treatments they've had a long time, and I love them. Because then the next patient brings me 400 pages of useless material that it's very hard for me to sort through, but when I see those protein numbers over time and what the treatments were, it helps me immensely, and believe me, if it helps me, it's going to end up helping you.
So there are many different types of myeloma, and some of the people watching may say, I don't know what type I have, or some of you may know I have IgG kappa, which is the most common type, or IgA lambda, or free kappa. The reason why it's important to know what type is that the ability for us to get the optimal outcome for everyone lies in knowledge and the power that lies within knowledge. Myeloma is unfortunately a disease of numbers, and you'll get all these numbers in your reports from your care team, and it's hard to interpret them even for people who are very seasoned at this. But if you know what type of myeloma you have, be it IgG, IgA, kappa, or lambda, you can use that information to better understand how you're doing in your treatment course. Are you doing better? Are you doing worse? Are my labs coming up? Are they going down? And this helps us work together as a team from the patient side to the caregiver side to provide the optimal therapy.
Tracking your myeloma markers and treatments can be hard to do, especially when you have a mountain of paperwork. HealthTree gives you an easy way to track your myeloma genetics, the treatments you have received, along with the outcomes of each treatment, and myeloma labs with graphs of these values for you, so you can see how your disease is changing over time and be more educated and empowered when it comes to your care.